Hi, I'm Dr. Rebecca Rentea, Director of the Comprehensive Colorectal Center at Children's Mercy. I'm a pediatric and pediatric colorectal surgeon. I'm joined by Dr. John Rosen.
And hi, I'm Dr. John Rosen, pediatric gastroenterologist at Children's Mercy, and I'm excited to be here to talk about things. And Dr. Rentea and I are sitting a little farther apart than usual today.
We wanted to chat specifically about bowel management in the time of COVID-19 and some of the challenges that we faced. Dr. Rosen, what are some of the biggest concerns that you've noticed that families have in this time?
I think a lot of the concerns that families have are the same ones that we do. How do we adjust to this new routine? We're used to leaving the house at certain times a day, going to bed, eating certain things, getting things in a certain way from stores or through the mail, and it's all a little bit different. And so when we rely on a routine, that routine is different in so many ways, and that's been challenging.
I wanted to define what bowel management is, which is, it's our concept of medically through either oral laxatives or through enemas that we start at the beginning part of the colon called antegrade enemas. And the goal for bowel management is really to have the child be clean for stool for 24 hours and to have bowel movements only when they want them to have.
And so really we're trying to achieve some predictability with these things in the management of bowels, and that predictability might be a little bit different right now. So how are patients adjusting to this, and how are you giving advice so that they can change their routines and keep up with the strategies that we have in place?
One of the great things that we have is we have telehealth medicine. And we've really made use of that, and I'm really proud of our team. We have right away been able to roll out multidisciplinary clinic visits. We've been able to have individual visits to really help troubleshoot when there's been an issue. I think you mentioned establishing a new normal. And so we have families that were able to, they didn't maybe see what was happening during the day, and now you're together a lot more, or you're together a lot less. So figuring out the way to find that new predictability is really important. What are some of the big things that you've seen with getting equipment, medications? What are some of the challenges there?
Yeah, I think I've seen surprisingly that things have stayed delivered on time from home health agencies, and I've been really impressed with that. There's been very few interruptions in deliveries for some of those devices and supplies that are always given to the patient, but establishing new deliveries has been a little bit difficult, and getting medications delivered or picked up has been even more difficult. I think one thing is people don't want to or don't have the ability to leave their home the same way that they did before. And so finding that medicines which they normally picked up on the way home from work, maybe they're not going to work now. So how do we get those medicines in the current time? And the other part is, how do I go places safely? Because sometimes the medical care or the medical visits require going somewhere, and I agree, telemedicine's been fantastic, and our visits together has been really helpful into a patient's home. But when you do go somewhere, how do you do it safely? And so I think pediatricians, health agencies, and then our group, of course, has tried to give people some advice on how, when you do have to go somewhere, how do you do it in the best way possible?
And I would say that our team has been really responsive using the patient portal to have families who anticipate that there's going to be shortages of certain medications, certain catheters that they're looking for that they don't have, that they're able to get those easily. And we noticed right away when we had some of our shutdowns announced kind of across the United States that a lot of families reached out. And that was really helpful because we were able to mail medications both from our local pharmacy here at Children's Mercy. We were able to call prophylactically to different pharmacies and kind of figure out how we could get families through at least a month. We're going to ask that families look ahead again for the next month because we don't know how long this is going to last.
We've had a lot of prescriptions changed to 90-day supply prescriptions where it's possible, and I agree, just talking to these families about what to expect, how to make changes, and answering questions has been great for us to know that they're doing okay, but also to talk about some of the challenges that they're facing.
I think one of the things that was really awesome is that because families can communicate with us through the patient portal, we've been getting a lot of feedback about some of the families' perception of some of the more difficult to pin down symptoms that children were having during the day that now they're able to see when their child complains of tummy pain or when a flush didn't go well. Some of the long weekends spent together have really resulted in some pretty big jumps forward in helping children with bowel management.
I agree, and as hard as it can be to be out of school, and to have these changes. What the parents notice and what the kids notice at home has given us opportunities to maybe change that regimen, change the flushes that they're getting or the bowel management to get even better symptom control.
I would say that one of the toughest things really for you and for myself, having a procedural component and a surgical component to what we do, is really that we're not able to do elective cases. And what we mean by elective is something where we decide ahead of time with the family that there's a surgery or procedure needed. And now we can't accomplish that at the same speed. There's been a lot of announcements, both from Children's Mercy as well as from individual departments, about how we can address that. And I think families should know that essentially we're waiting also to open up, and we're all prepared to be able to roll this out as smoothly as possible when we can return to all of our usual way of doing medications, surgeries, procedures, etc.
I agree. I think even though there's so many unknowns right now, there is the knowledge that we need to get back on track when we can. And I think the information that we get, we're able to give back to families pretty quickly through the portal, through electronic communication. And once we have that information and we know more, they'll know more.
And I think while this time has been extremely stressful, we have had amazing support both internally from our hospital across all departments, families, patients, et cetera. And I think what we've learned during this time will help us make a really safe transition to be able to open up business, maybe not as usual, but as the new normal. So we've learned how we can efficiently test patients before we come into the hospital so that there's no surprise illnesses that we have, and to make that actually a really seamless transition for all providers and children and families. I want to thank everyone for joining us. We hope you found this information about bowel management in the time of COVID-19 helpful. We welcome you to ask additional questions and to gather additional information by visiting our website.